This is week 4 musculoskeletal assessment. I will begin this first video with the upper body, okay, to separate it due to time restrictions. So I'll begin by assessing the hands and wrists. So I would explain to the patient why I'm here, what I'm doing, and try to make them as comfortable as possible. May I have your hands? So I'm going to first start by assessment. I'm going to assess for any abnormalities. I'm going to look for symmetry. I'm going to assess for redness, inflammation, or any other concerns. Once I assess the hands and wrists, I will then perform palpation. I will palpate each hand, and I will again assess for any kind of nodules, feel for warmth, and any other concerns that I have. Also assessing for things like rheumatoid arthritis, deformities, or other nodules that suggest other forms of arthritis. And then I will proceed with range of motion in the hands and wrists. So I will start with the fingers because they're very similar, the fingers and the wrists. I will have my patient perform flexion, extension, abduction, and adduction. So can you put your fingers down toward the floor for me, like this, and then up toward the ceiling? Okay, and then hands out in front of you. Can you spread your fingers and put them back? Perfect. And then for the wrists, can you just have one hand up for the video? And then can you turn your hand, this is abduction, away from the body. And then internally, that's adduction. This is going to be assessing for any kind of wrist abnormalities or anything like that. Also, besides that, there are some specialty tests. There's tests that you can conduct to check for fractures, which is called the snuff box. You're going to apply pressure to, which is right here. You're going to assess for any pain, which would suggest a fracture. In addition to that, a big thing with the hands that we'll see is carpal tunnel. So some specialty tests for that will be the 10L sign, which is, I'm going to have the patient hyperextend their wrist. Can you go like this for me? And then I will percuss, assessing for any kind of pain. In addition to that, the next test is called the Fallon test, which was on our exam this week. And can you put your hands like you're praying and apply pressure? You would have them apply pressure for approximately 30 seconds, and you would ask them if they're feeling any numbness or pain, which would suggest pressure on that and carpal tunnel. And then we have the Allen's test. This is when I would obviously do it on both extremities, but again, for time restrictions, I'm going to do everything on one. I would have the patient clench. Let me do it like this. Clench his fist tight. I would apply pressure on both sides of the radial and ulnar aspect, and then have him open his hand. The hand's going to be white. I will release pressure on one side, and the hand quickly turns pink. I would repeat this for the opposite side, and this is really important before performing ABGs and things like that because it assesses the circulation to the hand. So now I will go in, and that was the Allen's test. Now I'll go into the elbow. So I would again begin by inspection for any abnormalities, lumps, bumps, redness, swelling, pain, and I would palpate the medial and lateral aspects and the actual bone. And then for range of motion on the elbow, it's one of the simple ones. I will have him flex, and then extension, and then I'll have him do supination, and then rotate, pronation. Perfect. So that's for the elbow. And again, if there are any concerns or complaints of elbow pain, there are further assessment tests that can be conducted. And now, go ahead and put it down. Now we're going to inspect the shoulder. This would be best performed without a shirt, but we're going to have a shirt. So we would start in the, we're going to first start by assessing for any gross deformities, abnormalities, redness, swelling, pain, drooping, suggesting clavicle fracture. Have them sit up straight, and I would start right here at the suprasternal notch, and then palpate up to the summit of the shoulder and the acromion process. I'm gonna lift this up for the video. So I would go outward and really get around there, looking also for the bicipital groove. And then range of motion will be done on both sides after palpating and making sure everything's normal. So for range of motions, I'm going to have him put the arm straight out for extension, and then back behind him for, sorry, that was flexion, that's extension. Okay, go ahead and put it back. And then while they're performing this, I'm asking if they have pain, discomfort, things like that. And then for adduction, can you put your arm out? Sorry, it's kind of weird sitting down. And then to do, that's abduction. And then to do adduction, can you reach your arm across your body? Perfect. With your arm kind of down like that. And then assessing for pain. Okay, and then also for checking for internal rotation and external rotation, checking for rotator cuff damage or injuries, which I think will also be a common issue. So I'm going to have you take your arm, reach it behind, and pretend like you're scratching your neck. Reach it all the way to your neck. Excellent. Now go back, put your arm back down, and now try to reach to your scapula like you're going to touch it. Your scapula would be the bones right here. Perfect. Try to sit up straight when you do that. So I'm going to be assessing the patient performing that. You can put it back. There are some specialty tests that were a little bit confusing for me, but I'll perform them right now, which is the speeds test. So go ahead and put your hands in a fist and reach out, extending them like that. And then I would try to apply pressure on them. Try to avoid me pressing down. Right. Strong. And then go ahead and rest. That's going to be putting pressure on those shoulders and determining if there's pain, which would also suggest a rotator cuff injury. And these special tests are going to be done if that's their chief complaint, and that's why they come in. And so after shoulder, there's also the Neers test, which is, go ahead and put your hand out. I'm going to put my hand on the scapula, and then on this lateral aspect, I'm going to be pushing in and checking to see if there's pain when I'm putting pressure on that shoulder. And again, checking for rotator cuff tears or damage. And then the drop arm test would be, I'm going to have the patient stick his arm out, and then I'm going to ask him to slowly lower his arm to his side. Go ahead and slowly lower it as if you were standing up. Now, if the patient can't slowly lower it and it drops, that also suggests a rotator cuff tear or damage. Next, we'll do the spine and neck. I'm going to assess the neck, front, side, but for video, I'm just explaining. I'll check for symmetry, nodules. I'm checking that, make sure that everything is midline the way it's supposed to be. Feeling, palpating the neck for any kind of nodules or anything like that, redness, swelling, pain. And then as far as range of motion, I noticed that there was a trick that said that you can have the patient try to rotate your head like a complete circle. That's going to check all the way around range range of motion, and then head up. And then you're going to try to touch your ear to your right shoulder. Not your shoulder to your ear, your ear to your shoulder. And then the other side. And then that's going to be checking that as well. And then can you put your chin to your chest and then put your head back? Perfect. And then can you stand up for me? This is where we're going to assess the spine. Again, spine is best assessed without clothing, but we're going to be with clothing. So we're going to check the symmetry, and we're going to start right here at this bone at the C7, I believe it is. Starting right here going down, feeling for, you know, the natural back curve, and then it should go in like an S, making sure that he's midline, also palpating those muscles and feeling for any kind of pain, abnormal indentation. Go ahead and bend over and touch your toes. And here we're going to assess midline spine, making sure everything's equal in midline. Go ahead and stand up. And then I'll have you bend over, touch your toes. Again, because I didn't pay attention to how he did it. Okay, excellent. And then stand up. And then I'll have you kind of bend back. Good. Now stand up straight. Now bend side to the other side now. Great. Okay. And then also rotating. Turn around and look at me. And then I'll have you twist. Good. So that is the upper body musculoskeletal. Separate video for lower. Thank you.